With COVID-19 vaccine in limited supply, health systems must prioritize exactly which patients in eligible groups are offered it first. It can differ between systems, but in the end, the message from medical professionals is the same. Jenna Sachs breaks it all down in this Contact 6 report.
We thought we'd try today.
When helping her mom sign up for a COVID-19 vaccine, Nancy Tegeter turned first to her mom's doctor, then realized she'd have to look elsewhere.
Appointments way far in advance or no room.
They got her mom's vaccine at a walk-up event.
We thought there might be a mob here, but it wasn't.
Like pharmacies and health departments, hospitals and clinics are only getting a fraction of the first doses they're requesting from the state.
Our biggest challenge is getting a greater allotment from the state and for the state to get a greater allotment from the feds.
Froedtert and the Medical College of Wisconsin has administered 38,000 first doses so far, but is capable of much more. It's requesting 20,000 first doses a week, but getting a quarter of that.
I would say that our allotment the last 2 weeks has been better than it was 3 weeks ago. And I also know the state is getting more vaccine.
It's a similar story at Aurora.
I don't know any system in Wisconsin or really nationally that really has as much supply as they would like for the demand.
Health systems have their own methods for deciding who receives a vaccine first. At Aurora, it's a scoring system that prioritizes those over 65 with conditions that make them prone to being hospitalized. Based on emails to Contact 6, that's led to some vaccine jealousy.
Individual patients don't necessarily have full line of sight into every last detail about another patient's health profile.
At Froedtert, vaccines for those over age 65 went first to its highest risk patients, then patients of its primary care doctors.
We're now expanding to those patients who see our specialists.
But doctors say you don't have to wait around.
If you can get the shot anywhere, get the shot anywhere.
An attitude Nancy and many others are embracing. I'm Jenna Sachs, Contact 6.
Jenna, thank you. Health systems are sending vaccine notifications by mail, email, and text messages, but often the fastest option is to download their app. In fact, this week, hospitals are receiving their first vaccines for teachers, which come in separate allotments from the rest of their patients.